Kidney transplants are the most common form of living organ donation, but a shortage of donors persists amid questions and concerns surrounding kidney donation. To learn more, we welcome Dr. Carrie Jadlowick. She's a transplant surgeon at Mayo Clinic, Arizona. Welcome to Arizona Horizon.
Thank you. Happy to be here.
Yeah, good to have you here. Okay, living donor kidneys, how common?
So they're probably more common than you might think. On average in the United States, we see anywhere from between 6,000 to 7,000 people come forward to be living kidney donors every year. So last year we had more than 7,000 people that came forward and donated a kidney.
The benefits of a living donor kidney. I've read that it's a shorter waiting period and fewer complications. True?
Yeah, so those are all true. So there's a really big number of people in the United States that are waiting for a kidney transplant. On average, we have around 150,000 people waiting for a kidney transplant. And unfortunately, only about 30,000 people out of that 150,000 will actually get transplanted any year. And the difference between those two numbers is due to a shortage in donors. So living kidney donors can potentially fill in that void or that gap by helping people to get a kidney transplant faster.
Now, is it true that the living kidney donor transplants, those kidneys actually function longer?
They do. So it depends again, but on average, we see that a deceased donor kidney may last anywhere from 10 to 12 years. And again, averages are made up of highs and lows. Living donor kidneys can last anywhere from 15 to 20 years.
My goodness. Okay, so we got shorter waiting period, fewer complications, they function longer. How does the matching process work? Why are we, obviously, a shortage of donors, but this seems like this should be on a fast track.
Yeah, so I think a lot of people are unfamiliar that it's an option and also are unaware of, what steps it takes to become a potential kidney donor.
What are those steps?
Yeah, so the first step is just being interested and coming forward to be considered to be a potential kidney donor. So that's step one. Part two is actually going through an evaluation. I think that's another part that is unfamiliar to people. They're not sure of what that evaluation process might look like.
Is it with like blood tests and imaging and these sorts of things?
Yeah, so blood tests, meeting with a team of physicians, and learning more about, the donor's health, seeing if they are healthy to begin with, what their risks might look like with proceeding with kidney donation, and things to look out for afterwards too.
And so then you've gone through this whole process, and you're considered a good person there for. What is the process? What is the surgery like? How invasive is it?
Yeah, so another good question, and the good news is that part also has gotten a lot easier over the years. So there have been a lot of advances both in the evaluation process as well as in the surgical part of donation, and so now that process is minimally invasive, and it's also approached through a fast track type situation where on average most kidney donors will probably spend about one night in the hospital. A lot of kidney donors feel pretty well recovered by 2 to 3 weeks out after their surgery, and then they're able to resume all of their normal activities, usually within 6 weeks.
That's able to resume all of your activities, but you've just donated an organ. You don't have 2 kidneys anymore.
I know, isn't that amazing?
It is amazing, but I think that's difficult for people to get past.
Yeah. It's honestly easier and simpler, I think, than people realize. And a lot of transplant centers across the United States, including ours here in Mayo Clinic, have worked to make that process easier for donors. We know that people are busy, they have complex lives, and so the easier that process can be, we know that that'll make it simpler to, even come forward and potentially donate.
Now, but there are risks involved. What are some of those risks?
Yeah, so there's small risks. I think you can think of it in 2 aspects. So one are risks related to the surgery itself, and so those risks are all low. They're all less than 1%. We have a lot of experience with the surgery. The first kidney donation happened over 70 years ago in the United States.
Wow.
So we've come a long way, and we've had a lot of advances in surgical technique. So that risk is very low. And the other component to think about is also medical risk of potentially developing chronic kidney disease.
Yeah, well, yeah, you got 1 kidney now.
You do.
Do you think, it seems like it's dialysis and then it's transplant. Is this easier on the body, easier all the way around than dialysis?
For sure. So, the bridge, I would say, between dialysis and transplant, ideally is getting a transplant in between, which we call a preemptive kidney transplant. And so that's where someone is followed by, a physician. They're aware that they have kidney disease. They get referred early for transplant. And then we can start the process early of looking for a potential donor.
So it would be an alternative to dialysis. You would never start dialysis?
Correct.
Wow, that sounds like medical thought must have changed quite a bit on that, hasn't it?
It's the preferred approach, and it's what we try to, inform our patients about and our providers. But there are still gaps, obviously, in getting people referred early.
Yeah, I think the idea that forget dialysis, go for the that's just hard for people. Real quickly, before you go, the difference between a living kidney and living liver donations. Liver, you just need a little bit, right? Is that true?
That is true. So a portion of your liver gets donated in living liver donation versus in kidney donation, it's the whole kidney.
Yeah, okay. So basically, when we're talking about living kidney donation, this is the wave of the future. This is probably going to be something that we look back on and saying, holy smokes, I wish we'd have knew more about this back in the day.
I think so. We've already learned more. Now I think it's just a matter of spreading that information out to everyone else. So,
All right.
and the public.
And that's what you're doing, Carrie Jadwick. Thank you so much, Doctor. Good to have you here on Living Donor Kidneys.
Thank you.